Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Stephen Patrick, a pediatrician at Vanderbilt University in Nashville. They discuss what the Delta variant means for kids in schools and in hospitals, and his frustration with the lack of cooperation from community leaders who could help turn the tide on COVID, but won't. Let's listen.
Stephen Patrick, thanks so much for joining me.
It's great to be here today.
So most of this pandemic, we have focused on adults, which has made sense because they're the group that's been at the highest risk. And you're a pediatrician in Tennessee, and now we're seeing that kids are really affected. So talk to me about that and what we need to do.
It really has been an extraordinary journey that we've had. For the first part of the pandemic, we focused a lot on adults, and rightly so. They were the ones at the highest risk of death. But we prioritized many of our own activities over schools. And what we saw in the early parts of the pandemic is that kids really suffered as a part of it. We saw rising rates of food insecurity, loss of health insurance, worsening mental health for kids. So kids really suffered from the non-infectious causes and complications of the pandemic. But now we're seeing something completely different. We're seeing record rises in infections among children. Our children's hospitals are full. And yet we're still struggling to really focus on the needs of kids. And that's pretty disconcerting. In Tennessee right now, we're nearing 40% of our weekly cases among children. And there really haven't been comprehensive approaches to mitigating the spread of COVID-19 among children in our schools here locally. And we still really haven't addressed many of the complications that kids have faced from the COVID-19 pandemic.
Well, I was going to ask you, we really still don't know exactly how this will affect children health-wise.
There are many questions that are still lingering about long COVID in children. And I think when I talk to folks, many folks are really focused just on death and that death is rare. The odd part about that is that, yes, death is less common in children. However, one preventable death that should make us want to put a mask on. And it's sort of this bizarre conversation we're having around preventing child death. At any other time in my career, if I talked about preventing child death, everyone would be on board. So I think that's a bizarre conversation. But looking at death, it's just the tip of the iceberg. There are complications from COVID, many of which we don't understand. And of course, many children today can't get vaccinated. Kids younger than 12 can't get vaccinated today. And so it's really incumbent upon us as adults to behave like adults and do the things that need to be done to protect our kids.
So you're living in a place where masks are not commonplace. Is that right?
That's right. So in our state now, there's no mask mandate. And as we started schools, there was no mask mandate, at least in my kids' county. There were 2 counties that had mask mandates. And what we've seen is a big rise in COVID in our communities, including among school-age kids. Schools are starting to shut down. More recently, we've had in our county first a mask mandate for kids in elementary school and now in high school. But our governor ordered and had an executive order that allows opt-outs for anyone. And so we see really high rates of opt-out in some communities, 20 to 40% at some schools.
Mm-hmm. So you've studied the impacts that this has had on children, as you said. I guess I'm wondering how we can mitigate what's going on.
Well, both the Centers for Disease Control and Prevention, as well as the American Academy of Pediatrics, talk about a layered approach that begins with vaccination. It includes masking of teachers and students, and then other mitigation strategies like social distancing, appropriate ventilation. This is not a one thing. There's no silver bullet to fixing this. It's about silver buckshot. We have multiple approaches that need to be done. Right now, though, I think we're seeing in our community a lot of resistance to that, as is evidenced by many of the school board meetings we've had, even in my kids' school district.
Mm-hmm. I understand you got into a little bit of a Twitter fight with someone from your area who we may know.
Yeah, that's true. We have a retired NFL quarterback. His children go to my children's school district, and he's been very vocal about not agreeing with our school board promoting mask mandates. And honestly, I think it's important for us as healthcare professionals to challenge that narrative and to educate the public. And so that did happen on social media. I'm not sure that social media is always the most effective way to message, but I do think it's important that we as pediatricians and public health professionals that we continue in every possible modality. I mean, in our community, we've had pediatricians write op-eds, do press releases, go to school board meetings, certainly post on social media. I feel like as pediatricians now, we've never felt quite like this, like we're not being heard at any level. And it's sort of, let's do all things, press releases, you name it, Twitter against, retired NFL quarterbacks. If it helps just one person understand the science, and if it helps one person wear a mask, then that's good enough.
So that quarterback, for those who are listening, is Jay Cutler, who lives near Dr. Patrick here. I want to ask you, it feels like that kind of stuff, that behavior really gets in the way of messaging, because I know that there's been a lot of distrust and issues with communicating with the communities. And it makes me frustrated just as a bystander to see that folks like you, public health professionals, are being drowned out by those with big microphones and not a lot of experience in this field.
Yeah, I mean, ideally, what we would be doing is partnering. I don't want to be antagonizing, a former quarterback in my community. I want to be working with folks with the same goal. And the truth is, what's funny about this is our goal is the same. Our goal is to keep kids in school and healthy. Somehow we've lost the narrative on how to do that. And I think certainly on social media, people talk across each other. And as public health professionals, I think we've got to figure out a better way to do this. Our polling in the state shows that many folks don't know who to trust around COVID-19 or vaccines. We have not effectively engaged many communities, including local churches, who are still not talking about masks or vaccines, or even having congregations wear masks in church. That's a real problem, and it's incumbent upon us as public health professionals to try to fill that gap. I mean, it's easy for us to be on the outside and point fingers at Jay Cutler or at churches and say, why aren't you, following the science? It's a different step for us to sort of dive in and debrief and try to partner in positive ways as we prepare not only for the next pandemic, but for broader public health and child issues after the pandemic is over. I hope that this can be a vehicle for us to build enduring partnerships.
I know that vaccine rates in Tennessee are not high. I know roughly 50% of adults have been vaccinated, not a lot of children. Are you having these conversations with the parents of your patients?
Yes. Although, my patients are small. I'm a neonatal intensive neonatologist, but certainly we have conversations about vaccines all the time in the neonatal intensive care unit, as we have, mostly routine vaccines for kids who are in the unit for a little bit longer. Generally when you have one-on-one empathetic conversations with people, when you sort of work to try to diffuse the situation and foster trust, it works. One of the classic examples that I think about is vitamin K. We give vitamin K to infants shortly after they're born. And in my community a few years back, there was a lot of concern from a subgroup of parents about vitamin K. I mean, it's really just a vitamin. It helps prevent bleeding in infants after they're born. We had an outbreak of brain bleeds in newborns in 2013 from parents refusing. One night on call a couple years ago, I had a family refuse vitamin K, and I just sat down with them and talked to them about what it is and how the article that they were looking at that raised some concerns about vitamin K where it was faulty, and they vitamin K for their baby. That's true in many places. And I think these sort of one-off conversations, the Surgeon General released a report about misinformation and the toll it's taking on public health. That's true here too. I think we have to work to engage people where they are. We need to be empathetic. We need to be listening, and these one-off conversations. But I also think our leaders need to be part of that conversation too, in public health and in state government and local government. We need partners to help us to engage in those conversations.
Do you feel like you're fighting against the politicians and lawmakers in your state?
Sometimes it feels that way. I would say that the governor's executive order is worrisome to us as pediatricians. We see the reality. I was on service in the hospital last week. We see the reality of what our children's hospital is like, and it's hard to reconcile that with the narrative that we see outside. The executive order from our governor is now, there appears to be an investigation from the Department of Education about whether or not that's a disservice to kids with special needs. I do think it makes it harder for us as folks who are trying to care for kids and for kids in and out of our hospital.
Mm-hmm. And something I've been reading a lot about is this whole idea that if something's happened to you that's not COVID, there may not be a bed for you. Is that a concern in your community?
Yeah, absolutely. It's a concern in our community. The COVID is taxing everything. Our children's hospitals are full, and they're full with RSV. We're seeing increased COVID. For neonatal intensive care units, we may not have that pop-off valve to the floor, for example, for non-critically ill infants. And so our census may stay high in terms of patients that are there. It's making everything harder. And then the other piece of this is, now we're seeing staff get infected too. So it's making everything harder. The truth is that if we all got vaccinated, we all masked up, we got to a place where we had herd immunity in our community, these things would start to get better. This is a thing where we know the answer. We just aren't doing it in a way to make things better for our community. And I think that's what's so distressing about everything for pediatricians.
Mm-hmm. And as a parent and community member, what do you go through?
A lot of conversations with my kids about what's going on in our community. And I would say, I'm fortunate that my kids are healthy. My heart hurts for those who have kids who may be immunosuppressed and have to make the decision to send their kids to school and hope that people are doing the right thing, hope that school boards will make the right decisions, hope that the governor may change his executive order. Hope is not a winning political strategy all the time. And so I think we need to see action there. And the other complicating factor that we've had is our legislature made it harder to do remote school as well in our community. And so we're stuck in this situation where we aren't doing the very things that we need to keep kids in school in terms of the people that are eligible to be vaccinated, getting vaccinated, wearing masks. And yet we're making it harder for schools to go remote if they need to. So our school's interpretation of the rules are that they have to use inclement weather days for remote schooling. That's not what happened last year. And I think there is a noticeable worry in our state about learning loss. That's true. However, no school is worse than virtual school. And I think we've sort of lost the collective mission here. Why is it that this is viewed so adversarial? I don't think pediatricians have been used to being viewed as someone who has anything in mind other than protecting kids. And it goes back to even like the exchange with folks on Twitter. We have no motive other than trying to protect kids and trying to protect our community. And it's distressing to see folks behaving in their own interests, like a retired quarterback, as opposed to thinking about the collective interests of our community.
Stephen Patrick, thanks so much for joining me.
It's great to be here with you today. Thanks for having me.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.